Yeah, well, they're asking people to sign up to help with the COVID situation, and they're asking for volunteers specifically that have a medical background, like nurses, physicians, or people who can help with various logistical challenges like transportation, for instance. This is having to do with the COVID-19 response. However, they want to be clear that this is not because of any current emergency. This is a preparatory measure. They started talking about this idea of having these volunteers on standby about a month ago, and that was in preparation of the holiday spike. And then when they began to see places like California see increases in their hospitalizations, overwhelming hospitals, they thought now would be the time to ask people to sign up and join this volunteer corps in order to prevent a situation like that from happening here.
So what kind of tasks will these volunteers be performing?
Yeah, well, a lot of them will be dealing with patients, but not with COVID-19 patients. They want to be clear on that. These volunteers would not be treating currently sick patients who have the coronavirus. They would be more likely to be helping out with patients who have other needs, maybe helping people in recovery post-coronavirus treatment, so people who need help with day-to-day activities after being in the hospital, or people who need things like mental health care after being in the hospital. And again, a big one they mentioned would be simple transportation, moving people to places like facilities, long-term care facilities, where they can get assistance after being in the hospital. Right now, there's a lot of issues with staffing. They're making sure that these staff are well supported, because we've heard all year long that staff are strained. They've got a lot of work on their plate, and basically they're hoping that this volunteer corps can kind of take a little bit of that off of their plate and just make their jobs a little bit easier.